you guys are all here to do, is to really bring a local perspective to what policies matter to Houston and Harris County. There are a number of different reasons why the needs and the assets here in Houston, Harris County are unique. And these unique situations require unique and creative solutions. And that's part of your charge here with Healthy Living Matters. There's also engaging the stakeholders. There's a lot of folks already doing this work in different ways. And this is an opportunity, as Dr. Sanchez said, to really find common ground and move forward with an action plan that is really going to make some changes to the community. So some of the things that make for a strong local policy, a lot of local public health policy is really rooted in this idea of a police power, which is not the police like the police department. It's a constitutional power of government to promote public health, safety, and the general well-being of the community. And that's one thing that has to be one of the cornerstones of strong local policy. There's also really looking at what your unique needs are. How many of you are familiar with the concept of preemption? So just briefly, preemption is the idea that we're in a federalist system of government, and so federal law is stronger than state law, and state law is stronger than local law, and it's not always that clear because there are some powers that actually are not given to the federal government, but are actually given to the state governments. But what you have here is local health, as important as local policy is and strong local policy is. You may sometimes come up against state laws that prevent you from doing what you want to do at the local level. So these are things to be aware of and just kind of keep your eye on. And then finally, this idea of really identifying what the problem is and then thinking about, well, what is it that we want to pass? What is the policy that we want to pass in order to address this problem? And that's really the root of the legal basis, the constitutional basis for public health. So some of the options that I wanted to talk to you about from different jurisdictions. The first one I wanted to talk to you about is from Oklahoma. Last year, Seneca Scott, a state representative from Tulsa, introduced a bill that was intended to turn Oklahoma's food deserts into what they would call food oases. The bill proposed opening up an existing state agricultural loan to healthy corner stores. So the idea, I'm going to talk a little bit more about healthy food financing, which is something that can bring healthy supermarkets into certain neighborhoods, but this is building on the idea that there's already an infrastructure in some places with healthy corner stores. You might also have healthy convenience stores or gas stations might make more sense to the neighborhoods or areas that you're talking about. But what you can have is policies that set up certain types of loan programs or technical assistance that really help corner stores and convenience stores transform kind of unhealthy elements into healthier elements. What they did is they defined some of these stores that would market fresh fruits and vegetables and sell less tobacco and beer. And they would offer these stores below market interest rates and other agriculture-related small business incentives. And the idea was not just to increase healthy food access, but also to stimulate economic development locally. This program has been around, actually I said last year, but it's actually been around since 2010. And some of the results that they're finding there in Oklahoma is that Oklahoma producers are seeing more outlets for their farm products. Corner store owners now have an incentive to improve their offerings in order to access the new dollars that are available. Consumers in Oklahoma have more access to healthy food in their neighborhoods. And then the legislators are also, they're also considering these things not to be policy battles, but really policy victories. The Healthy Corner Store bill in Oklahoma passed both chambers unanimously there in the state of Oklahoma. Another example that we saw from the Weight of the Nation video is on complete streets. And there we saw just how it was starting out in Nashville, how they have bike plans and things like that. This example is from Columbus, Ohio. Like many communities, Columbus has these really wide boulevards that are not the friendliest places to walk or bike. So what advocates in Columbus did is they wanted to make these sorts of boulevards safer for pedestrians and bicyclists. So they proposed a complete streets ordinance. The idea of the ordinance was to require developers to incorporate biking and pedestrian infrastructure into new developments and require public works to incorporate sidewalks and bike lanes into new streets. They weren't able to pass an ordinance right away, so what they started with was a resolution. The resolution, as I mentioned, is less binding than an ordinance, but sometimes progress and change takes time. It takes a couple of smaller steps before you make the big step. So they started out with a resolution that just expressed support for the idea of being a more pedestrian-friendly city. And then once they introduced this idea through the resolution, they also worked on educating people inside and outside of government, advocates, stakeholders, lots of different community groups. And then they introduced an ordinance with more binding enforcement mechanisms in it, and more descriptive language about what was required of the complete streets there in Columbus. And that actually passed later on in the year. So Columbus is now starting to see complete streets as a reality, and I think it's a useful lesson for a lot of jurisdictions around the country, not just Houston, Harris County, that you can take steps in order to get to where you ultimately want to get to. And a lot of that is knowing what your environment is, knowing what your assets are, knowing what your needs are, knowing what the barriers you're up against, and then figuring out a framework that's going to ultimately get you where you need to go.